An Oxford AstraZeneca vaccine trial on children has been put on hold as the UK regulator investigates a possible link to rare blood clots in adults.
So we say it's rare. This is what it means. 30 cases of blood clotting have been identified, but more than 18 million doses of the jab have been given. So do we actually need to be concerned about the risks from the Oxford AstraZeneca vaccine? We're joined now by Professor Paul Hunter, specialist in medical microbiology. Good morning to you. And Dr. Helen Stokes-Lampard, who you'll know is the GP and chair of the Academy of Medical Royal Colleges. And we also have Dr. Amir Khan with us this morning too. Good morning to all three of you. Paul, let's come to you because, I mean, how concerned are you that, A, this trial in children has been halted, but also just the idea that the suggestion that actually rolling it out for younger people might now need to be slowed down until we understand the risks of blood clotting?
Well, I think it was quite sensible to delay the trial in children. I mean, we're not yet in the UK at the point where we are offering vaccine widely to people under 50. So I think there is some time to study the data better, to understand what the risks are in each age group. You're quite right to point out that by and large, the evidence that seems to be that this is something that tends to be occurring in younger people rather than older people. And so for the vast majority of people being offered vaccine at the moment, it doesn't seem to be a risk in that group. And indeed, even if it was, the risk would be so tiny compared to the risk of getting severe disease and indeed dying from COVID if you don't have the vaccine. So I think at the moment we've got time to better understand what the risks are, but we still haven't got time to actually delay the vaccination programme as a whole, and it should continue to be rolled out, as the Prime Minister said last night. Yeah.
Professor Hunter, as you touched on there, so we know that the risk of getting these blood clots is something like 1 in 100,000, but the risk for the same group of people, young people,
under
particularly
40.
In their 40s, of dying of COVID is 1 in 1,000. So that's a real difference there. And it's something that we talked about earlier that I think we need to understand. You guys work in the medical profession, this is what you do all the time, but this idea of risk-benefit analysis that happens with all drugs, all medicines. We take paracetamols when we get a headache. The fact is there are side effects and there are risks to that. None of us ever suffer from those side effects or suffer from those risks. But this is what you do in the medical profession, isn't it? So what we're seeing now is perfectly normal.
Well, absolutely. And in fact, I think when you said risk per 100,000, I think you're actually overstating the risk there.
Right, okay.
It's probably of the order of 1 in a million at the moment. But you're quite right. We don't exactly know what the age groups are that have been affected in the cases, so that there may well be age groups where the risk is greater. And I think this is something that will come out over the coming days. But the bottom line is that it is even, the risk, certainly in the people who are currently being called for vaccine, is substantially greater than that if they decline vaccine and catch it as a result.
There is a dilemma for some people, Helen, and we've had a few questions in actually this morning about this. Can I just put one to you? It's from Claire, and she says, I have an 18-year-old daughter with Down syndrome and a 26-year-old daughter with epilepsy. So they both have underlying health conditions. They are young. And both having had their first jabs. They're due for their second jabs in the next couple of weeks. Should they still have them with the blood clot news? The risks and benefits balance is such a worry as a single parent, she says. And that dilemma, I think, goes to the heart of the problem. Young people with underlying health conditions being offered the AstraZeneca jab. What do you do?
You absolutely go for that second vaccination. So it's a totally understandable concern. Every parent wants the absolute best for their child. They do not want to inflict unnecessary harm. But as Paul has already said, the risks of harm are incredibly low, even if this turns out to be proven. And as yet, nothing is proven as a risk. These two young women that we've just mentioned have significant underlying health problems that put them at higher risk. If they were to catch coronavirus, their risk of becoming seriously unwell or even dying is significantly higher than other people of a similar age. So the balance is very straightforward. Please do go ahead and get your daughters that second vaccination to give them that maximum benefit from immunisation. there are also other consequences of coronavirus other than the very serious illness, long COVID. We've heard today in the news confirmation that there may be increased risk of other disorders, mental health disorders, and dementia and so on. You know, this is a disease that is really, really unpleasant, and we don't yet know enough about it. But the more we learn, the more we should be fearful of it, and the more we should do the best we can to protect ourselves against it.
OK. Let's go for some more questions, actually, here. I think this is very useful. I think people have obviously got genuine concerns. Professor Hunter, Anna on Twitter has links up to what Janice also on email, both sort of touching on the same thing here. If the AstraZeneca gets paused in the UK, can you please ask what happens to those who have had the first dose? And Janice goes on to say, if you have had the AstraZeneca, can you have a dose from one of the others, whether that be Pfizer or the forthcoming Moderna vaccine? We know there are others on the way as well. Professor Hunter?
Well, the first thing is I think it's extremely unlikely that we would ever want to pause the AstraZeneca vaccine. In general, with the vaccination programme, ideally you should have the second dose from the same vaccine manufacturer as the first dose. However, studies are underway at the moment to check that whether or not you can mix and match vaccine manufacturers between your first and second dose. And generally with vaccines anyway, other than COVID, we know that it usually doesn't matter greatly if you mix and match different manufacturers. So AstraZeneca vaccine for your second dose, if it's your first dose, really you should be going for that, and I don't think that will be delayed. If we ever get into that position, I don't think it's something that we would ultimately need to worry about.
That's actually quite reassuring. But let's just ask Dr. Amir, whilst you're here, that what are the signs of having a blood clot? I mean, you know, it's there. It's something that we're now talking about. As rare as it is, I think people would want to know, how do you know if you're feeling it, if you've got one?
Yeah, so it is incredibly rare, these very specific blood clots in the brain. It is common to get minimal side effects after having the vaccine, such as a temperature, fevers, chills, headaches. But if your headache persists beyond 4 days after having the vaccine, then you should seek medical help. Other symptoms include blurred vision and nausea. And then as time develops, and if you don't get treatment, that can move on to seizures and comas. But headaches, blurred vision, nausea, particularly after 4 days, is when you should seek medical help.
Can it happen at any time after 4 days, Dr. Amir? Is there a time where people, or in, and something I was thinking about, I've had the AstraZeneca, is there a moment when you go, actually, I'm clear from this now, it's been a few weeks, I should be OK?
Yeah, so 4 days onwards, it's thought to peak around 10 days, but anything beyond 4 days, you should seek medical help. OK.
And somebody else suggesting here, I mean, this is the difficulty. Somebody here, I can't find the name, or John in via email says, I've been getting more migraines than usual. Just paraphrasing what he's saying here, getting more migraines than usual. This is the slight word, both a challenge for you guys, is that these migraines could happen anyway. Lots of things can bring on migraines, but people are going to be concerned now, relating symptoms that they've got to their vaccine. In John's case here, he's now worried about migraines and headaches. What would be your advice to people like that who suspect that things have changed a little bit since they've had this vaccine?
I think if things have changed, certainly speak to your GP. That's what we're here for, and I'll be taking, I'm sure, calls like this later today. We can help and help you decide whether it is actually just a continuation of your existing illness or it may be something more serious, and we may ask you to come in for an examination. So if you are worried, speak to your doctor about your symptoms.
Let's just end on an upbeat note, which is the Moderna vaccine, which is going to be given for the first time today. Helen, I know you're excited about this.
Well, I've got a personal interest in this. First of all, it's fantastic that we now have a third choice of vaccine for patients around the UK at a time where we're having some supply shortages on the other vaccines. It's essential that we keep up the momentum of the rollout. But I heard this morning that the first doses are going to be given in Glangweely Hospital in Carmarthen in South Wales, which is actually where I was born. So I have a great affection for that, and I'm wishing them all the very best this morning.
OK. Ahmed, just on another note, I was on Kelly Hoppen, yes, that Kelly Hoppen messaged me yesterday. And
who is she? Interior designer?
Interior designer. Yeah, still waiting for her to come and sort my bathroom out, but that's another thing. But Kelly Hoppen message, and apparently a few people have had this. She's had the Pfizer vaccine, and now some of her friends have had their appointment for the second dose cancelled, bearing in mind you're meant to have the Pfizer within 12 weeks. She's a little bit worried. Hers is due next week. Is that a concern? If you've had the first dose of the Pfizer and your appointment has been cancelled, what's going on there?
Ideally, it should be given at 12 weeks after your first dose. Delays and cancellations are probably due because of delivery issues rather than problems at the vaccination centre itself. We don't know for sure what happens beyond that 12 weeks, but chances are your immune system will pick it up and you'll be absolutely fine. I've spoken to an expert about this previously, and they don't think a few days either side of that 12 weeks will make a massive difference to your immune response.
Okay. All right. Thanks very much, Dr. Amir Khan. Thank you, Dr. Helen, and Professor Hunter. Thanks for joining us this morning on Good Morning Britain.
And thanks for all your questions. There's still so many questions.
There are.
But hopefully we've covered some of the main points there.
Absolutely. And also, as Professor Hunter said, there is no suggestion they're going to pause the AstraZeneca rollout.
It may be more down to a supply issue than a...
Yeah, exactly. And also, the one thing we have said before on this show, that the one thing this government has got right has been the supply of vaccines, which is just incredible. And just here, you know, we've got still to come, ultimate 100 million AstraZeneca, we've had 40 million of the Pfizer, still to come 17 million of Moderna. Then there's Valneva, Johnson & Johnson and CureVac as well. I mean, it's incredible, really. So if you haven't had the vaccine yet, you're one of the young people and you're worried, I wouldn't worry. There are going to be so many options available, fingers crossed, in weeks and months to come. And that is the one positive to come out of this.
It certainly is.